This webinar, as Nomi mentioned, is co-hosted by FRAC and Milk Swinning in the States. And we'd like to extend a special thank you to Beacon IA for their generous support of this work, and to our incredible state partners on this effort, two of whom you'll be hearing from during the webinar. Next slide, please. And today we're going to be diving into the new report from FRAC and Milk. Then we'll hear from our state perspectives from our partners at Hunger Free Colorado and the Arkansas Hunger Relief Alliance. We'll then wrap up with a look forward at some of the exciting opportunities that are presented for enhancing immigrant family access to food and nutrition programs, and hopefully some time for Q&A.
So in short, public charge is really the umbrella, policy issue that was influencing people's conversations and decisions on whether or not to access benefits during the research that we've been doing and continue to do so. I will say that we hope this Friday, as part of the president's announcements, that there will be an announcement about public charge, rolling back public charge to its previous definition. There are many, we also have the Supreme Court case. The Supreme Court is also potentially going to rule on public charge on Friday. So there's many things still in play, but long story short, the Biden administration has committed to rolling it back. So hopefully we'll never need to look at this slide again, other than to say that as long as you don't access cash, you're okay for the public charge test. But this was a big issue, and the confusion about it and the fact that it was an 800-page rule really was contributing to some of the confusion and anxiety. So with that, I'm going to pass it over to Alex to talk about the research we did to try and understand how public charge and other factors were influencing immigrant families' access to food nutrition programs. Alex.
Thanks, Jackie. Next slide, please. Jackie, you want to just
past that. Yeah, just to say, just wanted to make sure that folks knew that COVID testing and care is also not, and we just move over to the next slide, not subject to the public charge rule. Neither is pandemic EBT. There was a lot of confusion about that, and we'll be talking about that. Neither are any disaster relief programs. So during COVID-19, it's very important for folks to know that they don't have to worry. The stimulus checks are not part of public charge. So, most of the, any disaster relief is not considered part of public charge, and people should feel free to get vaccines and testing and care.
Next slide, please. All right. So about a year ago, we started conducting field research that informs the report. And the idea was to go to different regions of the country that represented, as much as possible, a blue state, a red state, a purple state, and then an area within California, a very blue state, but the Central Valley is actually more red. So we went to these different areas, and in each area we had a partner from the anti-hunger community and from the immigrants' rights communities. We did a series of focus groups. In each location, there were 2 focus groups. One was for mixed status families, and those were families where the parents were born in a Spanish-speaking country. Most of the families were from Mexico, but we did have families represented from Central and South America. We also asked that the families be selected so that they likely would make the gross income test were low enough so that they would be eligible for SNAP. And then we wanted to make sure that the families, the parents who were participating, had US citizen children who would likely be eligible for SNAP. So what we were trying to look at was like, children who are US citizens, would the fear about public charge and all the other threats to immigrant families impede access to nutrition, food and nutrition programs, SNAP, WIC, school meals, and emergency food distributed through food banks? We also, in each location, conducted a focus group with service providers who were well-versed in connecting families, particularly immigrant families, to food programs. So all in all, we were able to talk to 64 immigrant parents, and all those focus groups were conducted in Spanish by Jackie and myself. And then we were able to talk to 41 providers. In addition to the focus groups, everyone who got to the focus group on time filled out a survey so we could quantify some of the data. Next slide, please. So the report has a link to it at the end of the webinar, but we wanted to highlight just key findings. There are a lot of nuanced findings, but key findings were that of the focus group participants who were parents, a full 3/4 screened positive for food insecurity. And that was based on the hunger vital sign screening tool. A full quarter stopped using SNAP or some type of nutrition program due to immigration related concerns in the past 2 years. So we see, a clear connection between people who could benefit from nutrition programs because they're identifying as food insecure based on a research screener, but they're not able to access some programs because of immigration related concerns. Two other standings that really popped out for me were that, and that have implications for work moving forward, are that immigrant families were more likely to apply for Medicaid than SNAP. And some of the reasons that were teased out were that, it's almost become a crucial public service message that you need to have health insurance. Like we heard from some families, like if I don't have Medicaid or some type of health insurance, my kid can't go to school or they can't participate in sports. And there's obviously no substitute for medical care. While, you can be innovative and figure out ways to share food with neighbors and families and access other food programs besides SNAP, you can't go to, there's no substitute for going to a doctor. Another key finding was that immigrant families, parents were more willing to access SNAP and WIC for their children than they were for the adults in their family. And this really solidifies research that shows parents are willing to sacrifice their own nutrition for their children's health. Next slide, please. This is one of the findings related to the depth of food insecurity among some of the participants. They worried that food would run out before they got money to buy it in the last 12 months. Next slide, please. And here's a chart that represents what the nutrition service providers thought in terms of willingness or the degree of fear related to accessing certain programs, which again shows that the program with the greatest fear is SNAP. But even programs that have no public charge constraints to them, implications like WIC and school meals and emergency food, there still is fear in the surrounding communities about accessing these vital programs. Some of it related to public charge, but a lot of it related to other immigration concerns and access barriers. Next slide, please. And here's information on how immigrants definitely were more willing to access programs for their children than for themselves. And again, when we talk about food insecurity in a household, we often hear, and research validates this, that parents are not eating so that their children can eat, or they're sacrificing their own nutrition for their children. So this totally squares with parents acting and able to take more risk if it means their children are going to get fed. Next slide, please. Okay, I'll let Jackie take it away now.
Sure. So again, one of these are very consistent with existing research. Language barriers and discrimination, in particular by departments of social services, staff, when trying to apply for programs, in particular SNAP, were a big barrier that were identified by the families that we talked to and also the service providers. And there's just a lot of confusion about this term, public charge. When we asked folks in the focus groups, do you know what public charge is? There was really a lack of familiarity with the term itself, but there was an understanding of something about the connection between accessing benefits and immigration consequences. And there was also just really lack of knowledge about where to get good information. So, They were getting misinformation from, Univision or Telemundo, like traditional Spanish news outlets. They were getting misinformation from even attorneys. And there was really actually, what was interesting is that they were also critical of the kinds of sources of information. And they were clear that, sometimes the people on Univision didn't know what they were talking about, even sort of very solid news outlets. And so, that's something that, I think is an important barrier that we need to think about where folks are getting their information. And then the other issue, of course, was real concern about, they would be willing to apply for the program. They'd get the school meals application, and then they would see that they had to put personal identifying information on there. And they were just terrified that if they put information there, that they would be shared with immigration authorities so that they would, stop applying midstream. So, ultimately sort of the two, these are very consistent with findings. You can read more of them in the report. But, I think that some of the big pieces are that, we want to think about as we pivot to sort of thinking about the state perspectives are, how do we figure out, what is working in terms of getting people to enroll their kids in school meals or in healthcare like Medicaid, and how can we translate those victories, in terms of successful enrollment to programs like SNAP and other programs, and really have lessons learned. And I think there's a lot to be learned from the Affordable Care Act, for those of us who are involved in implementation of that, and trying to figure out how we can leverage those lessons learned for food and nutrition programs. Next slide, please. And then there's one more quote slide, and then we're going to actually turn it to the states themselves who are doing the work. Again, like the issue, the climate of fear, the climate of people hearing, that they were going to get deported, that their children were going to get deported or taken away from them if they used food stamps, was really pervasive. And I think the quotes tell the story even better than the graphs and the pictures. And, it's going to take a lot of work to repair trust between immigrant families and, the government. And that's going to require a lot of public education and a lot of rebuilding. But let's switch now to state perspectives, because I'm sure you'd much rather hear from the groups on the ground that are doing the work day to day. Next slide, please. And our first state panelist is from Colorado. It's Anya Rose. Next slide, please. I guess we'll hand it over to Anya. Anya, you're on.
Thanks, Jackie. So my name is Anya Rose. I'm the Public Policy Manager at Hunger Free Colorado, and I will just share a couple pieces of our work from this year that really flowed out of the learnings from these listening sessions, and then a little bit of what we're thinking about policy-wise looking forward. So following the listening sessions, we decided we wanted to dig in more on changes and outreach strategies to improve access to programs even beyond SNAP. So in partnership with FRAC and Milk again, as well as the Colorado Immigrants' Rights Coalition, we organized a virtual bilingual summit to bring together food access organizations, immigrant serving organizations, state and local agencies, and community members from around the state. And we focused on identifying barriers to access and then suggested program changes and outreach strategies for pandemic EBT, which had just been created at the time, summer meals, school meals, food pantries, and WIC. And part of what we wanted to do was also get a better understanding of experiences across the state, because those listening sessions had just been in Denver. So we quickly compiled all the input we'd gathered, especially on PEBT, into a report with recommendations for that program for state agencies, which was just in time to inform their approach. And then it helped back us up when we advocated for more accessible applications and messaging, since that was such a whirlwind process. And then for the other programs that we'd focused on, we did follow-up surveying throughout the summer and compiled all those learnings into a report with recommendations on the remaining 4 programs that will actually be posted to our website later this week. So I'll make sure to share back. And that whole process really informed how we approached advocacy and outreach on pandemic EBT more broadly over the summer. We'd heard really loud and clear that community members wanted to be hearing from their trusted community leaders about programs. So we put together an extensive outreach toolkit for PEBT with materials in multiple languages, coordinated with our state agencies on that. And then one of my amazing colleagues led an effort to disseminate this child nutrition information within immigrant communities across the state through promotoras, through a network of community leaders. So that effort was really successful and taught us a ton about how we want to approach this type of community education and outreach campaigning going forward. So we partnered with and funded 17 immigrant-led organizations and groups across the state for targeted outreach campaigns on PEBT, summer meals, WIC, and school meals. And then those trusted community leaders were reaching out to immigrant families in their communities using social media, providing info at existing program sites, giving presentations, and then providing actual application assistance as well.
Anya, can I interrupt you because people don't know what PEBT is. Can you explain what PEBT is?
Absolutely, I just saw that in the chat. So PEBT was a program created this past spring by Congress to provide a benefit to replace the missed free and reduced price school meals that families were missing due to school closures from the pandemic. So instead of getting meals at school, it was money on an EBT card for families with children that would have qualified for free and reduced price meals. And it was a pretty significant benefit, and it was open to everyone who qualifies for free and reduced price lunch. So there were no immigration requirements. And I know in Colorado, that was $279 per eligible child just for those 3 months of school that were missed. And Congress has extended PEBT, but it's in various forms of next steps for round 2, depending on what state you're in. And so we worked with these really varied groups. I mean, some were formal organizations, others were less formal community groups like moms groups that mostly organized through Facebook, for example. But they already had that trust and the networks in their communities and were able to really run with the toolkits we created. And I'll just touch on a few of the lessons learned through that work. We learned that providing technical assistance on things like using Google Drive and Zoom was really key. And it reinforced the importance of, this is basic, but compensating promotoras for their community expertise and leadership. That was really appreciated by our partners. We also learned that we should more intentionally build advocacy into efforts like this in the future because it created really strong feedback loops on what was and was not working well in these programs. But we had really focused on outreach. So we sort of had to build some systems on the fly. And then the flexible toolkits with things like sample presentations worked really, really well. And then finally, we heard that there was a real preference in communities for programs like PEBT that aren't restrictive and that do allow for more family choice. So that's a program that we'd really like to see live well beyond the pandemic in the form of summer EBT. And for that same reason, obviously want a really swift rollback of public charge and then the opportunity to expand SNAP to more immigrant populations. So then at the state policy level, I'll just touch on one thing we're working on, but we're part of a coalition that's supporting legislation this section to fix some really damaging laws that were put on the books in Colorado about 15 years ago. So in the summer of 2006, Colorado held a special legislative session, and it was actually a time when Democrats were in control. And it really focused on further impairing immigrant rights and opportunities. So among the bills passed and signed into law were one that required verification of lawful presence for state and local public benefits, including all professional and commercial licenses, and another that required verification of lawful presence for contracts and services, and really just sort of imported federal verification of lawful presence law into our state statute unnecessarily. And so we've seen a lot of negative impacts of those over the years. For example, important contributors in areas like childcare and healthcare and education, you name it, can't access the licenses they need. And there have been cases of misinterpretation of these laws leading to folks getting denied charity care in hospitals and generally creating hurdles for state programs or resources going to immigrant communities. One example of the negative downstream effects in the nutrition space that I just want to call out is that there are a lot of informal childcare providers in Colorado, and they're a crucial part of that ecosystem. but many can't prove lawful presence and so can't be licensed. And in order to get federal meal reimbursements through programs like the Child and Adult Care Feeding Program or CACFP, you need to be a licensed provider. So by shutting people out of childcare licensure, we're also limiting the federal nutrition resources for the children they're serving. So new laws at the federal level would be great, but they could actually leave Colorado immigrants behind if we at the state level don't deal with these harmful laws now. So part of how we're preparing to improve immigrant access to these programs is by cleaning up our state situation and making sure that we don't have additional barriers to immigrant access of services at the state level as we see opportunities to improve access arising at the federal level. And I'll wrap it up there. Oh, actually, I think the next slide might have one of our materials on it. Yeah, so this is just an example of a sort of Colorado specific public charge material that we put together based on Protecting Immigrant Families campaign's stoplight document. And that's sort of an example of the kind of thing that was built into our toolkits.
And I should say that we really liked their design, and they were happy to have other people look at it. And I've shared their materials with other state partners who have borrowed heavily from them because of the clarity of a really complicated topic. So kudos to Colorado. And I think we're turning it over to Kathy Webb in Arkansas.
Thank you. My name is Kathy Webb. I'm the Executive Director of the Arkansas Hunger Relief Alliance. We're the statewide anti-hunger organization. We work with food banks, food pantries. We do a lot of the advocacy work, SNAP outreach, and federal nutrition programs. And I have to say, regretfully, that we had not done intentional outreach in the immigrant community until the focus groups. We knew there was fear because we worked with a few groups, but it was after we got the results from the focus groups that we started to intentionally reach out to groups across the state. First of all, by using the contacts we had, because we knew that we were not a trusted partner, and we knew the degree of fear was so high. Susan mentioned fear when she was talking, and we knew that was one of the driving factors in Arkansas in terms of people not accessing benefits for which they were eligible. At the start of the 1920 school year, we had reports that immigrant population in schools was significantly lower than it had been the year before, that people were even afraid to send their kids to school. And we went on the Spanish-speaking radio with friends and talked about the importance of enrolling kids for school. And as we were doing a lot of this outreach, that's when, and we were making plans for a summit, the pandemic hit. And with the passage of the first relief bill, we started contacting the people that we had just done outreach with, the people who were excluded from benefits. And also we got the report that so many people who qualified were afraid to access benefits. So we turned in part from federal nutrition programs to making sure people had emergency food. And because some of the food delivery systems are set up so IDs are required, we launched a grocery card program and distributed over $13,000 in grocery cards to folks who didn't qualify for benefits or who were afraid to get benefits. And another example of the fear and bad policy, there's only one diaper bank in Arkansas. I know the people who ran it. I heard from our friends in the immigrant community that they were afraid to access the diaper bank, and we found out that they required a birth certificate. And even though they were not going to give that birth certificate to anybody that was a barrier to access. So we started informally also acting as a diaper bank. We did a lot of Spanish-speaking radio when PEBT came out, and one of the quotes that we have is one of the women we worked very closely with said that she spends most of her time telling immigrant families that if it's from the government, it's bad. So suddenly we had to flip that message around completely. We've been telling you if it's from the government, it's bad. Now you're going to get something from the government and it's good. And we want you to use it. So that was just like overnight. And fortunately, we had developed relationships by then that we were able to do Facebook Live presentations, do a lot of radio presentations, and really get the word out that PEBT was good. The Hunger Relief Alliance had a 1-800 SNAP line for SNAP outreach, and we realized that we wanted to have accessibility for non-English speaking people. So we hired 2 Spanish-speaking people to act as translators. And in the first couple of weeks after PEBT was approved in Arkansas, we had over 800 calls from Spanish-speaking Arkansans who wanted information on SNAP and PEBT. And unfortunately, some of the time when people even were told that they qualified for SNAP, they chose not to fill out an application. We discovered big barriers with WIC, and while we saw a lot of WIC enrollment in some states going up, in Arkansas, we discovered that there were a lot of barriers for Spanish-speaking participants. Because of this intentionality, we were able to secure an unrestricted grant from a foundation, and we chose to use $50,000 to go out in mini grants to Spanish speaking organizations across the state, and allowed them to use it for grocery cards or whatever the need was that they felt was most important. We were able to work with the food banks to have 2 days a week where we distributed farmers to families, boxes specifically to the immigrant community. And at those distributions, we also had Spanish-speaking volunteers to help people sign up for the census. We had our SNAP flyers in Spanish, and that was where we most often met with our congressman, because when he came to pass out boxes, we also were able to talk to him about how immigrants had been excluded from relief bills and how we needed to increase benefits for SNAP. As the year went on, in December, we again received some unexpected donations, and we were able to use specifically $27,000 for Latinx organizations, which means once we started this work, the Hunger Relief Alliance has added almost $100,000 specifically for organizations. And that would not have happened without the focus group and the report that we got. So while a lot of our activities involved emergency food and food distribution, we always use that as an opportunity to make sure that everybody who was eligible for a federal program knew about the program, became more comfortable in enrolling for the program, and as an opportunity to communicate with our elected officials. As I said, because of the pandemic, we postponed our summit and we're planning on a late March or early April summit. We will now have groups that we've worked much more closely with over the last year, and we hope to get a significant amount of additional information that we can use to help us make better decisions about policy going forward into the next year. So this work has become a critical part of what we do. We're very grateful that we've had the opportunity to begin to tackle this and start to become a trusted partner. Thank you.
Thank you, Kathy and Anya, and we are so grateful for your work on this issue. The last few years have been terrible at the federal level with just a series of unrelenting attacks on immigrant families, and it's really great to see how the states have jumped up and innovated and figured out ways to address the need and the growing need during COVID-19. So thank you. Next slide, please. So in addition to some of the fabulous state level actions and ideas that Kathy and Anya shared, we wanted to just highlight some of the actions that came out of the report. And please, if you're doing work in the immigrant food access realm, feel free to add in the chat box some of the work you're doing, which may intersect with some of these actions. Next slide, please. So I'm just going to talk a little bit about some of these initiatives that are going on in the 4 beacon states we work with, but also in states across the country. So here are some opportunities for states to really move the dial and connect immigrant families to food and nutrition programs. A number of states are working on food for all campaigns, which take different forms. Many of the campaigns are trying to fill the gap left in what type of immigrant status is eligible for SNAP. So one such type of program are the state food assistance programs that allow states to provide funding using the SNAP-like benefits, using the SNAP infrastructure to immigrant families who were eligible for SNAP prior to welfare reform, but who are no longer eligible for SNAP. So that's basically lawful permanent residents who have not met the 5-year eligibility requirement. And there are only 6 states that provide that funding, but those states are, one of them's a big one, California, Connecticut, Illinois, Maine, Minnesota, and Washington. And we're working on a piece that explains that program and opportunities for advocates to push for it in their state. There are also coalitions that are forming to try and develop state programs so that anyone can access food benefits no matter what their status is. Of note, California has been launching a Food for All campaign. States have also been using COVID relief funds and state funds to shore up distribution of emergency foods to different groups, as well as in some instances having monetary relief funds targeted to different groups. So that's one way they've been innovating. One barrier that Jackie talked about was transportation to food sites, which is not only affects immigrant families, but it can also affect anyone who's trying to access a food site or the need to go in to apply for a food program. And there's an intersection that makes it a little bit more difficult sometimes for immigrant families, which is that if folks are worried about ICE raids or being out in public, like transportation takes on a different dimension because even if the transportation site might be close, you still might be afraid to go to the site because of the fear of being out in public. So some ways that folks are innovating on transportation is taking a look at where they're locating emergency food sites or distribution sites and really partnering with trusted community groups to locate food sites that immigrant families are going to for other services and they can get food. Some programs in the time of COVID for older adults, congregate meal sites are they're shutting down congregate meal programs, but they're delivering food to prior participants. So transportation is a tricky issue to fix, but it's something people are really focused on. The other issue that came up time and time again in the focus groups were language access barriers. And some of the takeaways were the need to make sure not only the materials are translated and that there are interpreters available, but that the translations are not done sloppily. They're not done by Google Translator, or they're not done by someone who speaks a Spanish that isn't the same Spanish as the community group you're trying to reach. So there were a lot of key ideas on how to improve language access. And key to that was really trying to hire culturally competent staff, or partnering as Hunger Free Colorado did with community groups that are really embedded and trusted in the community. Jackie, take it away.
All right. So wait, what's up next? I think that there's lots of things that we can do. Wait, are we talking about legal representation? Okay, we're still on legal, on state. So, I think that there's lots of other things, and I wanted to also flag that Food for All California is launching their statewide campaign to provide food for all this week. I will drop the registration for another webinar, because we all need more webinars, right? We're not enough of them. And I think that sort of thinking about how we can think about sort of a national model to sort of spread this to other states is really crucial. Wanted to just, again, flag, and I mentioned this in the side chat, that there's a website, keepmybenefits.org, that allows folks to sort of find out, to ask basic questions, about when they're thinking about whether or not to access benefits and whether or not they need to be concerned. So for example, maybe someone who's about to take their, to naturalize, to take their citizenship test, wants to find out, do I need to be worried about my kids using Medicaid? Like, that website will help answer that. And there's a hotline. And you can put your zip code in to find out if there's legal representation, where there's legal representation nearby. And I will say, one of the things that we hear a lot, and we always say, and I'm an Argentine and a New Yorker, and we always say, like, put New York and California in a different room, because they always have so many more resources than everyone else. And I know that it's always been frustrating to folks to go to big conferences where they hear California and New York and even Colorado and well, Arkansas also has a wealth of riches, talking about how much they have there. And I remember one FRAC event, we had someone from Pennsylvania being like, you're sitting here talking about immigration attorneys. We have one immigration attorney for the whole western side of the state. You know what I mean? Like, how are they supposed to, provide those benefits? But, I think that there are benefits, and increasingly, those types of resources are available nationwide. Again, driver's license, it's counterintuitive, but things like driver's licenses for all campaigns that I've been really involved in, giving folks access to identification, and also, as Kathy was saying, really working with providers. Often there's a lot of lack of information in food pantries and food banks and in other places about the need to be able to accept a range of different documents. And so ensuring that every food service provider and food and nutrition program has that, and then working with your state and locality to provide alternative IDs is crucial. And ultimately, we want to address the root causes of poverty and of income inequality and of hunger and food insecurity. So, getting involved in farm workers' rights and minimum wage campaigns and labor laws enforcement is also key to that. But lots of stuff to do in the states, and also, working with COVID relief funds, from the federal government. Some of those funds actually didn't have immigration status restrictions on them, and obviously they're very much needed, but, working with your state to ensure that everyone is eligible, because many of these funds did not have those restrictions. So with that, I think I'm passing it back to FRAC to talk about some of the big changes we're looking at. Next slide, please. In federal actions that we can take to address these barriers. So is that, Alex, is that you, or who else from FRAC is taking the next section?
That's me, but you were going to start, next slide, please, with the, I'm sorry.
Yeah.
Sorry, I don't have this, anyway. Yeah, so these again were find strategies that were lifted up by the focus group participants, both the parents and the service providers, which very much align with work we've been doing at the federal level and some of them at the state level. So we will sort of give you an update on how these things stand. But everyone really wanted to rescind the public charge rule. And, you know, people wanted to make SNAP available to a wider group of participants, but also make sure that the gross income test remains higher than, you know, the 130%, so that if people were working and still had need for food, they would be eligible for SNAP. Next slide, please.
Yeah, so that one was me. Is there another, is FRAC going to do more, other folks from FRAC are going to chat more about food policy stuff?
Talk about recent changes to SNAP,
PEBT.
but also ATN's our PEBT expert, so she'll share about the news on PEBT.
Okay, why don't we maybe let her talk about that, and then we can finish up with the immigration stuff.
That sounds good. Hi, everyone.
Go ahead, ATN.
Hi, everyone. Okay, great. Hi, everyone. This is ATN Melcher-Feldman with FRAC, and I want to briefly discuss the big opportunity we have now to ensure families have the nutritional resources they need while schools are closed or operating virtual learning models, and that's PEBT. As Anya mentioned earlier, PEBT is a new program that provides families with grocery money on a new or existing EBT card to help fill the school meals gap. At FRAC, we've been working to ensure that all states implement a PEBT program and to push them to implement strategies that ensure all eligible children are able to access these program benefits. And we know this program has been critically important for immigrant families, as it's for many the only assistance they've received during the pandemic. We were really excited to get an extension and expansion of PEBT earlier this fall, so that students and their families could continue to receive benefits from this program this school year. And the latest bill also extended PEBT to young children that receive SNAP and are in childcare that have experienced facility closures or reduced hours. So we are eager to see USDA's guidance on the provisions included in the latest bill, and we expect that to be released in the next week. But encourage you to reach out to your state agencies and push them to implement a PEBT program this school year. You know, that being said, 6 states and Puerto Rico have been approved to issue benefits for this school year for school-aged children, but we hope to see that to be everybody, all states and territories. And as advocates, when talking with your state agencies, you know, making sure, see what their plans are for PEBT 2.0, what they're planning to implement, what their plan looks like, and you know, if you know what worked well last time, what didn't go so well last time, especially making sure that they're implementing strategies to reach immigrant families and push them to include language on public charge and all resources, have materials in multiple languages, and work with trusted partners. I think Colorado did a fabulous job, as well as other partners, but I know Anya mentioned that earlier, with doing outreach with trusted partners in the community to families. And so thinking through that and making sure that's part of your state's plan, I think is really important. So we have a few resources that I think are going to be on the final slide of the presentation, but encourage you to engage with your state agencies about this, as well as, you know, spread the word about how PEBT is operating in your state to make sure families take advantage of this program. So since benefits will be available, so it was administered last spring and summer, some states were able to issue benefits for September, August, and only the 6 states and have been able to start issuing benefits for the fall. But this is something, if schools are closed or operating virtually through the end of the school year, it's something that's available to families. And so we hope states definitely take advantage of that. I also just want to mention, you know, we're thrilled that schools have been offering free meals to all students through the summer nutrition waivers, and know that this has been also extremely important to families, and we'll be working through various channels to continue in the hopes that, schools can continue to offer free school meals to all, whether that be through administrative or legislative action. So we'll keep you posted on that, but just wanted to mention those pieces on the federal level and what we're watching.
Thanks so much, ATN. I wanted to flag that at the end of the webinar, we have links to resources, including PEBT and FRAC's transition plan to end hunger, or to address hunger for the Biden administration. Just wanted to quickly share some good news on the SNAP front. So in addition to work moving forward to getting rid of the public charge and getting rid of the 5-year ban, there are opportunities to strengthen SNAP for currently eligible immigrant families and their children. You all may have remembered submitting comments opposing 2 SNAP rules. And the good news is that in January, these 2 SNAP rules were actually rescinded. One was a rule on categorical eligibility, and one was a rule related to how utilities are factored into the SNAP benefit calculation. And these rules would have stripped 3.1 million people of SNAP eligibility. It would have made it harder for hundreds of thousands of kids to access school meals. And it would also have lowered SNAP benefit levels for tens of thousands of households. So good riddance to those rules and goodbye. And thank you for all your help in pushing back against those rules. So we've been delighted so far to see that President Biden, twice in his first week in office, has announced a set of strategic actions for eradicating hunger. ATN talked a little bit about the PEBT actions, but there are also actions related to SNAP that I wanted to make sure you were aware about so you could continue to support them. One action is to begin work to address the inadequacy of SNAP benefits. I'm sure all of you who work with families that are benefiting from SNAP hear about how sometimes benefits will run out before the end of the month. So this is an opportunity to push to re-examine how SNAP benefits are based, to look at a food plan that's more adequate so that benefits can last throughout the month. There's also efforts to continue the 15% SNAP benefit boost. Right now it's set to expire in June. So efforts to keep that continuing until the economic recovery is complete. And then there's also work to issue guidance to states so that the emergency allotments that have been going to families during COVID-19 would also benefit families who are struggling the most. They didn't receive any emergency allotments, and there's guidance to look at how those allotments are determined to see if families who are typically the poorest and the families most struggling would get additional SNAP benefits. So that's all good news. We're really excited about how many of the opportunities and strategies FRAC and partners have been pushing for years and years are actually on the table to be discussed. So stay tuned and get ready for lots of advocacy this upcoming year. Jackie's going to close us out with some of the immigration-related efforts that tie to access to food and nutrition programs before we take a few questions.
Yep. So, I mean, and please do drop your questions in the chat. I'll just put our transition priorities for the new administration link in the chat as well. Our Freedom to Thrive plan. I mean, ultimately, what will solve a lot of this is creating a path to citizenship and legalization, for the 11 million folks that have been here for years without access to an opportunity to change their status, obviously including those in the DACA program and temporary protected status and the, DED and other programs. So, we're working on that. Really, the Biden's first President Biden's day one immigration bill. We haven't seen all the details yet, but we're looking forward to kind of pushing that. There's also another effort to try and do an essential worker legalization program that you'll be hearing about, recognizing the fact that because so many immigrants were essential workers, that they should be provided a chance to adjust their status given the service that they provided. And, of course, on Friday, we're hoping that they'll announce the rescission of the public charge rule, and we hope that that will happen soon. And, down the line, we really, we're working towards trying to eliminate these waiting periods, right? From a public health point of view, it's really clear that, COVID, if it's taught us anything, and it's taught us many things, is that, none of us can recover if everyone isn't included in relief programs and in access to safety net programs and healthcare. So, to have, lawful permanent residents, green card holders that have decided to make a permanent residence here in the United States and having them have to wait 5 years until they're accessing programs doesn't make any sense. I think also, just as we were mentioned earlier, I'm really trying to make a push. I just gave a briefing to members of Congress this morning to push them to build on the Navigator program that was so successful in the Affordable Care Act, and have them be able to train navigators to tell people about other programs as well, like such as food stamps and SNAP and food banks and food pantries and other kinds of resources that might be in their area. And ultimately, we just need to remove those barriers and recognize that, again, we're all healthier and stronger when everyone has access to, the food and nutrition programs that they need. So with that, I think we're on our last slide, or the resource slide. And, if anyone has any questions, we're right at coming up on 4 o'clock in Eastern time. And remember, we have Colorado and Arkansas here in case you have questions for the amazing advocates there. Is everyone zoomed out, or we answered all your questions comprehensively?
I think the former.
I'm certainly zoomed out.
Well, please, we hope to have ongoing conversations about this. Don't hesitate to contact us if we can be of any assistance. Love to hear what you're doing, and look forward to connecting in the future. Thank you all for your amazing work.
And we got one final question about immigration attorneys. And as the National Immigration Law Center, I will say that sometimes immigration attorneys are a problem because they're narrowly focused on winning an immigration case. And, they'll want to get rid of any types of obstacles between winning that case. And they'll be very conservative. But, I think that the important thing is that, that is exactly how this works to chill people from accessing benefits they have every right to. And, people need to be healthy and to win their immigration cases. And so, we've been doing a lot of education around immigration attorneys. So if you have any questions about that, feel free to reach out. But it takes everyone, right? And I think that what's amazing about this that we've seen is it's not just immigration attorneys who have a monopoly on information. Kathy and Frack and Anya all have a wealth of information about what's going on the ground and the communities themselves. So that's really where the riches of knowledge are.
Well, hopefully in the next year, we'll be able to visit some states and really go out again. Jackie and I miss our road trips. So
we do. I had frequent flyer status for the first time in my life, effective December 2019. All for nothing. So anyway, help me build up those frequent flyer points and invite us to come over.
All right, everyone. That's a wrap.
Bye, everyone. Bye.